for joining us this afternoon, Senior Marketing Specialist, and we have the honor of hosting our friends over at Cigna Healthcare. As you can see, we have a few of them here with us today, which is so exciting to talk about the off-season opportunity. The sort of thought on this webinar is Q2 is kind of a limbo zone where you're getting out of that OEP, getting out of that wrapping up AEP, but it's right before a bunch of AEP prep begins. So, what can you do with this time? And we thought of our friends over at Cigna Healthcare. They'd be the perfect people for this. We have our friends David, Chris 1 and Chris 2. We have two Chris's on there, but they will do a short introduction because I just don't think I would do a good enough in introduction for each of them. But I'm your host. Oh my goodness, cat got my tongue this afternoon. I am your host, not your toast, Sadie Palmer. I am the team leader of training and education here at Senior Marketing Specialist. But these are the real stars of the show. Please feel free to use the live chat throughout. We will be monitoring that and answering your questions. We love to interact with you. It makes our job a lot more fun on this end. But if you're watching this recording, please feel free to comment below or give our office a call, and we will connect you to our friends over at Cigna. But I will stop yapping now, and I will hand it over to you guys.
Thank you so much, Sadie. We really appreciate it. My name is David Raymond. I'm on the national distribution team. I work primarily with senior market sales on a top line level to help drive business. I'm always here to help out for anybody who needs it. But honestly, today I am just on the sidelines. I have brought in two people who are much smarter than me. My role here is just going to be to show this pretty face and to answer chats as they come in and bring it to my panelists. I'm going to now pass it off to my two co-hosts. We lovingly refer to them as CP squared in our offices because they are both CPs. So CP squared, please take it away.
I'll respect my elders and let the first CP go and introduce.
It's I will be turning 46 tomorrow. I got the team came together and sung me a birthday song. Each one of them decided to do their own note and octave, so it was a pleasure, right? I'm glad they're not they're in the insurance business and not in entertainment. So, but anyway, much thank you to those guys. Anyway, Chris Proctor is my name. I am the senior supervisor for the virtual broker manager team, which is everybody east of the Mississippi on the virtual side, which is another layer of the broker managers. This is my 18th year in the business, born and raised in the Midwest, Louisville, Kentucky. So just right down that elevated Ohio River. But now I reside in Central Texas where the climate's a little bit warmer and it doesn't rain for 5 days in a row. Started off as a broker, 12 years, and then came over to the corporate business, the corporate side of it with Aetna, Humana, and now Cigna. And look forward to having this conversation with you guys.
Awesome. And I am the younger CP, Chris Falsgraf, and I do not have nearly as long in the industry. I have about a decade in the healthcare industry in particular, but in terms of sales, just been really cranking out a pretty fast-paced career just the past few years. Proctor, I know as he mentioned, we are both senior supervisors for the virtual broker manager team. He has east of the Mississippi River, and the easy way to pretty much say where I'm at is going to be the west of the Mississippi River. And you can probably tell from my Mississippi in the background that I'm actually based in Mississippi, but looking forward to diving in with you guys today. Awesome. So we'll go ahead and kick some things off. I know where you guys are located in the heart of the country. I know that there is a great football team right up the road from you guys. I know there used to be more than one football team, but I know that's probably still a sore subject. But we know that the Kansas City Chiefs right up the road from Columbia, they are just really on a tear the last few years, forming a dynasty. And really at the helm is this guy on the picture here. who is really becoming the GOAT. And, he may already be the GOAT. We just don't, want to officially say that yet. But the greatest of all time, Patrick Mahomes, really doing just a tremendous job in the league. And when we were invited to come and tag along today, we were talking about the offseason. And that's it's interesting because our offseason in Medicare is very similar to the NFL offseason, right? This is where it's a little quiet. You have folks coming out of the draft very soon, but then you also have a lot of things happening behind the scenes that maybe all of the folks that are fans are not necessarily seeing at the forefront. But there's a lot of important work that's happening in the background. And we know that Patrick Mahomes is, even though he's been to the Super Bowl a handful of times now, in the past few years, we know that he is just going beyond that point, not only working during football season, doing, being the best, but then there is a lot of background work that he is doing in the off season. And I would imagine, I don't know his exact regimen, but I would think that he is staying as sharp as he possibly can. So that way, whenever they start training camp here shortly, they'll be ready to go and probably be back in the mix with the Super Bowl. Speaking of the Super Bowl, I know this is probably a salty subject here still for our Chiefs fans that may be listening in today, but we know that the Philadelphia Eagles took home that Lombardi this past go around, and that's okay. And I really admire both of these guys. We know that Jalen Hurts is probably not considered in that GOAT conversation necessarily, but I think he has a grit and both of these guys have experienced some adversity at times in their career, even though Mahomes is definitely, at the peak of his career. But we know that there have been times that they've been overlooked in their careers and really curious on whether or not, they would really be the best. But they're both making a case for being two of the best quarterbacks right now. And just obviously, getting the results. And that's where, we look at people in the league, in the NFL. I'm a big fan of the NFL, big fan of fantasy football, so I'm very in tune with a lot of what happens there. But we know that the best in the business in the league, they are probably working year-round. They are probably carving out opportunities. They don't lose their gains. They map out the road ahead. They're not just, stumbling on to the next thing, and then they are planning on winning again. I would be willing to bet that no matter what happens to the Chiefs, no matter what happens to the Eagles and how they structure their roster, I'm sure that they have full intentions of being back in the mix, of being at the Super Bowl, if not this year, within the next couple of years. And that is what really, that grit that we talked about with Jalen Hurts, that's one of the things that I admire about both of these guys. And really anyone that follows kind of the same regimen in their offseason. Others, however, we know, some of the athletes that are out there who kind of stay in the headlines, but they may work intermittently. They may not be as, attuned to working on things during the offseason. They may skip their training camps. They settle for easy, the low-hanging fruit. They lose track of their gains. They go with the flow, and then they hope for the best instead of truly mapping out what they want to do. So where does this come into the mix in terms of talking about the off-season opportunity with Medicare? Agents, it's the same way. And as I mentioned, the off-season is very similar to the NFL season. Our prime time is a little bit before the Super Bowl, right? But the playoffs, they start in December usually, or that early week of January. And then, but our prime time is obviously AEP, and we are definitely excited to get back into AEP. It's a huge selling season for everyone. Very great opportunities in that time. But the off season is where I think a lot of the work that is going to set you up for success during AEP. That's where you can find that. You can find that during the off season because you have folks who are working year round. That's not to say that you take a breath. I know that January is a huge time to, once we're past that, you get your new effectives going. It's time to take a breath and maybe take a quick vacation. But a lot of the best agents that are out there, they're getting right back in the grind for OEP, and then they're staying in the grind for lock-in and all those other times throughout the year as we get prepared for AEP again. They're carving out opportunities, not necessarily settling for that low-hanging fruit that may be out there, They're also working on not losing their gains. A lot of people, especially this past AEP, just had tons of success getting out there with their business, and lots of folks who were just interested in our plans this year, not just at Cigna, but all over the industry. But it is so easy. If you turn away for a quick second, you can lose your clients just like that. And I know that that's where we talk about don't lose gains. That's, some of the best agents that we have out there are really doing a good job of that retention aspect. And the great news about that is we have some great resources that we'll tell you about in a little bit if that is an area that you struggle in, because I know there's a lot of folks who do. But then they're also mapping out the road ahead, and then they're planning on winning again. If you won during AEP, you're going to do what you can to win during OEP, and then win during the rest of the year, and then, of course, set up for another successful AEP. So very excited to talk with you guys about the offseason opportunity, not in the NFL, but in the Medicare industry, and where Cigna comes into the mix with that. I think you guys are going to like what you're going to hear today. We're going to talk about first winning with winners. I'm going to turn it over to Proctor in a moment. He's going to walk us through a few things to point out. And, some of these are things that you already know, but some of these are things that in this evolving industry you may not be truly aware of. And there is a lot of dynamic shift around here at Cigna that we're excited to share with you. But Proctor's going to talk us through winning with winners. Then we're going to look at some off-season selling opportunities. Some of these are things that you probably know because you hear about it everywhere you go in this industry. But then there are some others that maybe aren't considered as much because it does take a little bit of extra work. It's not that low-hanging fruit, but can really be fruitful for you currently, but then also set up for successful opportunities during AEP. And then we're going to make sure we don't leave you. We're going to talk about resources throughout the presentation, but we are going to recap a few resources at the end, and we are happy to share that with Sadie after the call. Any resources that we share today that would be helpful for you and your business, even if it's not just your Cigna business. I think there's some great principles in there that just in the way that you do your business, period, I think can be helpful. And then we're going to talk about some couple next steps after this call if you want to engage with us more and get everything you need to know. And then we will be happy to take any questions that David has agreed to take a look at in the chat as we get them coming in, but then we will be happy to address those verbally at the end. So I'm going to go ahead and turn it over to Mr. Proctor to walk us through winning with winners.
All right. Thank you, Falsgraf. If you guys want his personal cell phone to send hate text to him after he gracefully put the legals up there, reminded you guys of that loss, let me know. I'm here to help out. So anyway, winning with winners. You go to the next slide, please. Better together. That is the Cigna Medicare slogan that we've used all year. And with this culture and this team, we really live by that, right? It's being on this side of the table. If we feel it every day, but I can speak for my colleagues, whether it's a strategist or a local broker manager or a virtual broker manager. Our love for this industry, I've never quite seen anything like it, right? It's people don't just show up to do a job. They come to their computer or they come to these events or they answer their phone with an eagerness to make sure that the broker that they're talking to is put in the best position possible. So we understand that this is not an individual thing, that we are really better together. And you guys are such a large part of that. Internally, we see the numbers and how they align and where we're putting our attention. And I'll be the first to tell you, and all three of these, or all three of us can corroborate this, the local broker channel is our primary channel. It's where we focus our attention, our resources, our manpower, which is you all, right? And me being a broker for 12 years before coming to the corporate side, which I know that's a little bit backwards, right? I know how important that is. It's important to get with a good FMO that brings us together in a venue like this. And then the people that are with the carrier that can partner with the FMOs, make sure you guys are as strong as you can be. And there's winning products and winning solutions. And all those things together make for a very cohesive and a positive a culture for people to be successful. And just to reiterate what Fallsgraf said, I saw a quote on LinkedIn the other day, and it was talking about a CEO, and the one thing that he saw over and over again that just was there present in highly successful people, and it wasn't education, it wasn't resources, it was grit. It was grit. At the end of the day, grit is what's going to get you where you want to go. So again, lock in is one of those time frames where it's harder to grind, but it's never been more important to create the momentum going into AEP, and it begins on April 1st. Next slide. Pretty much covered this. The winning team. We have a local broker strategy or local broker channel. We've got a virtual broker channel, which adds another layer to it. We're handcuffed to our computers, so we can get in there and do things, conduct virtual trainings and topics and areas where you guys feel like you need some growth. We've got a fantastic strategist team. We've got David Raymond, who's on this call here. These guys are the smartest people in the business. It's unbelievable sitting in the phone conversations and in the meetings with them where they build out these strategies with the FMOs, and then the virtual team and the local team help execute that strategy. And on that point, again, our mentality is to help you guys grow. So if you feel like you're stuck, or you feel like you can't get to that next level, pick up the phone and get on the phone with one of us, your FMO, to get in contact. We'll help you build out a strategy, and we'll call everybody that we know to help put that together for you, right? Like if you win, we win, and we know we're not going to get all the business, but if we get a little bit of business, just keep us in mind, right? And we'll talk about that part later. But I do want to address the elephant in the room, right? Like I didn't get the memo on the Cigna shirts. That's because I don't have any more Cigna shirts, because we have officially rolled over to HCSC. The good part is we are going to stay our own plan. There's not going to be an integration into the Blues, at least for the next couple of years, from what I understand. So we're going to have our own plan. We're bringing the same team over. Everything is intact. HCSC is extremely excited to make this acquisition and this merger. We're excited. They're excited. This is going to be a really good thing. Again, more people collaborating together, more perspectives, and we're better together. So don't, if you guys have heartburn on that, we can talk offline, but this is a very good thing. Everything is going to transition over to the same thing. Okay. Might be a name change in there, but more to come. So winning products, we have a national carrier, right? We got 29 states, including the District of Columbia. We continue to offer MAPDs that stay consistent. We live and die by the MLRs, and if you watch the news, you kind of see the changes with some of the other carriers because they've let their MLR slip. We keep a very low a market leading MLR, which allows us to have little or no change year over year. That's our goal, right? We understand that when carriers, and I understand this too, coming from the industry, right? Like being a broker, the last thing you want is to have 90% of your book of business with one carrier, and all of a sudden they just roll out a new plan, and you got to go out during AEP and roll all this business over to a plan. It's a plan change to you. A lot of times even with the same carrier, or a plan exits the market and you got to move those people over. We all go into AEP expecting to get new business. So it's Cigna. Our culture is to have as little change year over year regarding our plans, so that you guys can focus on bringing new clients over to us. All right. And we do offer supplemental benefits on all those plans, and we'll get into those a little bit different, touch on those more specifically later. So winning solutions, we have tons of experience on this team. We have lead generation, we have retention tools, we have trainings. I have never personally seen an agency or an SGA or even an FMO that reached out to somebody at Cigna, whether it was a strategist, a regional broker manager, which is one of us, or a local broker manager, and said, I need more training on this, we rounded up the troops and put something together for them, even if we had to create it ourselves. Tips and tricks, everybody at Cigna are really, really, really generous with their time and their effort. And then self-guided resources for selling, enrolling, and servicing clients. We got Producer U. We'll do 10 trainings a day for you in your agency if we need, right? To make sure everybody gets up to speed. Next. All right, best off-season selling opportunities. Next. Special election opportunities. Changes to these. Next slide.
And real quick, Sadie, I just wanted to pause before we get into the opportunities here. Any questions so far about anything that we've covered that you want to just expand upon?
Yes, it looks like there were questions in the other live chat. For some reason, they're not showing up on our screen here, but on YouTube, it looks like we have a couple questions. Speaking on winning, saw your wincentives. Is that monthly or quarterly?
David, you want to take that one?
Yeah.
Honestly, I am not familiar with what you're talking about. I'm being completely blunt. I do not know what you're talking about.
Oh, okay. It was a typo. He said, speaking of your bonus, are your bonuses monthly or quarterly?
Is he talking about our HRA/value-based enrollment, which is something that we offer? Okay, I'm going to assume it's that because I
Okay.
love talking about that, and it's probably covered somewhere in here. But long story short, if you write an HMO or a PPO with Cigna, if you complete a health risk assessment with us within 10 days, you will earn up to $75. You will earn $75 per write if it's an HMO or a PPO. You earn $125 if it's a DSNP or a CSNP. On top of that, if you do the app electronically, and I don't care how you do it electronically, as long as you don't kill a tree, okay, we will give you $30 for a valid PCP and $20 for a valid email address. So, putting it all together, you can make up to $125 on top of your commission for writing an HMO or PPO with Cigna, and $175 for writing a DSNP or a CSNP with Cigna. I'm gonna go ahead and guess that's what he was talking about. Unless he meant CSB, like a Med Sup, in which case I am not as familiar with our CSB side. We are all on the MAPDP side, and we love to talk about CSB, but we are not the experts.
Sure. Yeah. If Clayton, if you want to clarify in the chat, feel free to. Otherwise, we'll assume that David delivered exactly what you wanted. And then we have one other question. What would you say are some lesser known reasons why an agent should write a Cigna plan for their clients instead some of the other big carrier names? I'm sure you guys will kind of get into that a little bit, but that's just another question we have on the live chat.
I've been waiting on that one. I can take that. So, our prescription drug coverage that's attached to the MAPD did not change from 2023 to 2024 or 2024 to 2025. So we all know that we saw the deductibles, the cost share. We knew there were big changes changing. We kept the deductible off. We kept the cost share on the tier 3 to a co-payment, also at tier 4. So in regards to the IRA, what a lot of people don't understand is that if there was a deductible on that plan that the carrier paid for, that $500 went towards the $2,000 max amount of pocket. And then the way that the equation worked, it takes the most either 25% of the cost of medication or the cost share or the copay, whichever was higher. So if you have a copay of $44 for a tier 3, 25% of the medication went towards the $2,000. So these plans are not equal, and I'm not sure if everybody fully understands how that everybody was going to pay $2,000 and then the carrier would pick up. In some of the cases, especially with Eliquis, somebody goes in the donut or the max amount of pocket in April and have zero cost share for the rest of the year where they still have that cost share with other carriers. That was the number one thing that I saw separate everybody or us from everybody else. Now there were some carriers that were able to do that, but in a lot of these markets, it wasn't even comparable. But because people didn't really have a full understanding of how that worked on the back end, they just assumed, and they didn't go out and see their clients and move them over to what was going to save somebody thousands of dollars or up to a couple $1,000s in costs. And then we've got benefit structures. I'll take Ohio and St. Louis as two examples where we kind of got the wrong end of the stick on star ratings. We haven't been in market long enough, so we had to use another plan code to piggyback off of. Some other carriers used a 5-star. We actually used another star rating, one with the Pacific Northwest, but it's driving us down in Medicare.gov. Our benefits are market leading, but you don't see us in Medicare.gov or Sunfire because the influence of the star rating pushes us down. So I want to bring that, illuminate that, because if you look at these plans side by side, and I'm from Louisville, so I
think we may have lost Proctor for a second.
I was going to say, was that just me, or did we
all
all?
with all the carriers devoted? Yep.
Yep. So, in a nutshell, definitely stability overall. I think that's the big, and that was the key message that we were portraying on the winning products slide.
And no drug deductible on any of our HMOs. Copay structure on tiers 1 through 4. As Proctor was saying, in a nutshell, it's just with drugs, we save clients money.
Yeah.
Awesome. All right. And we'll pick back up for some questions in just a bit, Sadie, just to see where we're at with things. But excited to go through some off-season selling opportunities. And we kind of have this broken up into 3 parts. We address first the special election periods that we all kind of know is something that you may need to work toward to make, to find out who your prospects are for this due to some marketing limitations, but excellent opportunities out there. And then Proctor is going to walk us through a couple things in terms of new beneficiaries and in the turning 65 or some of those who delayed some of that eligibility. And then we'll wrap up the off-season selling opportunities to go a little bit deeper into the supplemental benefits side that we mentioned. And as David mentioned, we're attached primarily to the Medicare Advantage and PDP side. We do have some cross training that we've had on some of these products, but we do have a team of experts that we can always tap into for some deeper information on that. But always great to know, because there is no wrong door when it comes to a Medicare portfolio. Real quick, just want to tell you about one of our few resources that we're going to cover today. This is an election period guide that actually just got released last month. We have not seen one of these to this. It is about one of the best election period booklets that I have seen. If you have not had a chance to dive in, I think can be very useful no matter which carrier you're writing. But definitely really user-friendly. Excited to see this great work that they put out, not only addressing the standard election periods as far as new to Medicare and whatnot, but then also going in deeper on some of these special election periods. And so highly recommend downloading a copy of this. We'll make sure to get that to you afterward, Sadie, so that we can have that distributed if needed. Looking at some of the main off-season SCP opportunities, the main ones you're going to run into are going to be gaining, changing that dual LIS status, especially in some of our markets where we have some strong products that are in that dual space. We also have a few chronic special needs plans in a couple of our markets that we have that's if they qualify for that chronic condition, which diabetes is the main one that we see get into these plans, but we do have that available with a special election period. We also have a couple of others, other creditable coverage, which presents a unique opportunity for our Medicare Advantage only plan, so minus the prescription drugs. But that is going to be a great opportunity to get some folks potentially into the Courage plan that we offer, which we know there's a few carriers out there that are kind of more of a household name when it comes to a veterans plan, but we have designed a nice package in several markets that I think will give them some of those folks who qualify for VA TRICARE for Life, get them in touch with some unique benefits that they don't currently have on a plan. So we have that opportunity available with some limitations, definitely some things you need to know about with this particular election, but we have that in our job aid that we have for the election periods. And then finally, we do have client was affected by government issued disaster or emergency. And I know there are some specific nuances to this to make sure, especially marketing. And that's a note that we had, be mindful of marketing limitations. That is, and these are centers of influence here that I think are great places to come across prospects or some great opportunities. But there are some limitations when it comes to some of those special election periods to just be mindful of. And that anyone on our team is happy to have a chat and make sure that you're fully aware of what some of those are to make sure that we're keeping you compliant, but also still giving your clients some great opportunities. Referrals is always going to be king in terms of this off season, because it's the easiest. If you have happy clients that you have met, or potentially family members of some of those clients, that is a great way to get some of that traction in there. And so always look for your referrals, and that's why in a lot of our retention resources we constantly just tell you to seek those referrals. Any opportunity you help a client is an opportunity to get a referral, and just make sure that you're being compliant with that as well. But then also looking at community centers of influence. And on that note, kind of that bottom square, nonprofits and service entities that are in that community. So it's not just your senior centers that may be there, where you can find some of these clients. And if you're working, you have a good relationship with those. But then you also have a lot of places in your community that work with low-income clients. And some of those may be connected, indirectly through some of your experience. If you're like a Rotarian in getting connected, or United Way, working with various agencies, that is a great opportunity to open some of those doors. And then also continuing those conversations with provider partners. Highly recommend getting in the loop with certain clinics, doctor offices that I think are friendly to brokers, because I think they get a lot of questions about Medicare and insurance, and especially Advantage. There's a lot of misconceptions out there, and I think they would love to partner with a knowledgeable broker. So definitely provider partners, but also cultivating those relationships during the off season, because I think that gets overlooked a lot. You have a lot of folks that may, October rolls around, they're ready to get back in that doctor's office, but that relationship is built over time and cultivated throughout the year. And then finally, veteran organizations, and we mentioned that we have that plan, and a couple of plan call outs here, including the Courage plan there. But veterans organizations would be like your VFWs, American Legions, and Cigna actually has some opportunities that we've had with some of those organizations currently that we would love to share with you if that's what you would love more information about. A few call outs in terms of our plans, and these are all plans located in multiple markets across our footprint. There are some differences to how they are set up. For example, the total care plan, we do have that set up a little bit differently. We have a full plan, we have a partial plan in some markets, but then you also have a few places to call out Texas specifically. We have an excellent total care D-SNP plan there that is, it's the same plan for all levels of Medicaid coverage, whether it's full or down to those partial levels, SLMB and whatnot. So great opportunity to get some clients in there. And I know that there has been some changes to the D-SNP landscape in terms of who can qualify for some of these things, in terms of the changes. That quarterly change has gone away. We know that, and that's mentioned in our election period booklet. But we do still have a very attractive plan for some folks that would qualify for it with a valid election, and definitely recommend not looking over any of those change in Medicaid clients or change in LIS. because that, may open those doors as well. We also have some internal resources for helping to see if your client is qualified for any of that. We also have the CSNP that we mentioned, chronic conditions, really focused on meeting those needs, but we have a plan available in Arizona, but then we also have on the East Coast, Delaware, Maryland, and Pennsylvania. And then finally, we have that Courage HMO plan. We have that available in multiple markets. And this is going to be a plan that, again, doesn't have that drug coverage, but it's going to be for those VA TRICARE for Life recipients who don't have access currently to a lot of great benefits like dental, vision, hearing, transportation. And then there are also some plans that have a Part B give back attached to that as well. So great opportunities across our national footprint that we would love to chat with you about. I'm going to toss it back over to Proctor to walk us through opportunities for new beneficiaries.
All right, thank you. So as we all know, I think this year, and correct me if I'm wrong, I think either this year or next year is where we peak on people turning 65 in the calendar year. I think after this year, the baby boomers, it starts to kind of start moving down the other side of the slope. So we're right there at the peak time frame. Just tens of thousands of people are turning 65 per month. And, that's obviously a big focus during lock-in. No shortage of those people. It's just developing the right strategy and how to attack it. It's changed and things are not the way they were when I first entered this business in 2007, when you just sent a mailer out and 4.5% of those came back and you went and saw those people, right? Like, that's gone. That doesn't work anymore. So now it's we can help you guys along with some things. We got some vendors that we use. We got some larger scale things, leading response, and those things are things that we see agencies using. So more on those conversations, but these are the three. Delayed Part B, which we know that did change. It gives you a little more time on that. The eligible before 65, the MRD, and then obviously the new Medicare. So any questions on any of those, or any questions on how you guys can get in front of those people, we will share what we can and what we know. Key off-season SEP opportunities, referrals, community centers of influence, expos, hosting T65 seminars, which again, I just alluded to, provider partners. Next slide. Again, kind of redirecting back to the strength of our plans, right? We're not going to wow you with $1,200 towards golf clubs, right? That got rescinded a little bit, right? It's not as good. That was a bit of a disaster, right? So we like the core benefits better than we do the added benefits. Not that we're saying that we don't have them on there, but you'll definitely see that the core benefits is definitely where we draw our focus. The max amount of pocket, hospital copay, primary care, specialist visits, dental coverage, and then you're obviously what I consider to be the leading thing, the deal breaker of all deal breakers is if the PDP coverage on a plan is insignificant, you got to move to the next one. Okay, so this just illustrates those important things in words. There's the added benefits that you will find on our plans nationwide. Every market's a little bit different. Dental, vision, hearing, transportation, OTC, fitness, home delivered meals, companionship program, caregiver support, living needs allowance. Pretty much covers it all. Again, we don't get super flashy with these, so our benefits are there. Our core benefits are there. Our added benefits are there. But again, we just didn't go that route of being ultra flashy. Okay. Again, the incentives, we talked about the HRA a little bit, the additional $50 for DSNP, and then the doing things. This is the healthy rewards that go on there, right? So as your members do their routine maintenance and do all those things that they need to do, they get money added to a card upwards of $200 per year. Next. Okay, so again, I think we've already talked about this, the special election or the election period guide. We have this resource for you guys. It's wonderful. All right, take advantage of it. We put all this stuff in Producer University. If you guys do not know how to get into Producer University or could use a refresher, please reach out to one of us, and we'll get either a local broker teammate or a virtual to help you guys out. This is the broker resource guide. It's a wonderful product, illuminates where we have plans. You guys have a nationwide um, footprint as well. Texas is a big thing. You know, we see them in all. We see your folks in all our states. Um, please take advantage of this. It's also in the Producer University library as well. Other selling opportunities. Next. Is this where I turn this over to you, Mr.
Yep,
Craig?
I'll take it back over. We'll wrap up our selling opportunities just by talking about, we've already addressed Medicare Advantage and just the awesome opportunities that are out there. Would love to talk to you more in depth about what is available in your market. And we have some great resources to recap in just a few minutes on that. But Medicare Advantage, obviously a huge part of our business, but it's not just the only part of our business. And we have over the past few years been a little bit more siloed, where Cigna Supplemental Benefits was their own standalone piece. We didn't have a lot of crossover in terms of knowing about their products, even though they've had some strengths on their side. But we've been very excited the past year to get a lot of information on that. And so we have Medicare Supplement, we have standalone PDP, and then we also have other supplemental products. And the great news about it is that following the acquisition, we have all come over together to the same place. And so we're still on the same team. We have a lot of unity out there, and we are excited about some of the opportunities that are presented with some of these great products, not just for your Medicare eligible clients, but also a lot of these will open up some conversation for folks if you have under 65, especially if you're working with a lot of ACA clients. There's a lot of opportunities out there with some of these. Just to highlight a few of them, we also have a few other ancillary products like Express Scripts. We still have that partnership. A lot of our vendors that we have had with Cigna Healthcare are still intact. And so still a great partner for us in terms of that home delivery pharmacy. But then we also have very competitive dental, vision, and hearing plans, hospital indemnity coverage in a lot of states that just expanded and really got aggressive with the product. Really one of the best products that I've seen on the market, and very excited about some of those doors that could open up. And what's great about some of these products is it's not just your standalone products that you can sell in appointments, but I think a lot of people who sign up for Medicare Advantage plans, there's great opportunity, especially with something like a hospital indemnity coverage. If they're getting a high give back plan that maybe has a higher out of pocket amount, and some of those higher copays on some of the things like hospital and whatnot, I think that's a great way to offset some of that indemnity there. And then we also have some accident insurance. We have a lump sum cancer, heart, and stroke policy that's out there. So really great options out there, and I love to rub this into Proctor all the time. I have one of my teammates on my team who just joined recently. She's a several decades expert in supplemental products, and so very spoiled to have her. But we have awesome opportunities that we can set up. Even if you're not located in the West region, we have some great expertise that we'd love to share with you wherever you are. Speaking of wherever you are, this is a look. I know we have a lot of folks in the heart of the country, in this group, but I know you guys have a presence in all over the country here, and great opportunities for Medicare Advantage. That's going to be your dark blue, where you have that. But then the states that are not dark blue, the royal blue, that's going to be PDP and Med Sup territory. And then when it comes to Medicare Supplement, you're going to have that in just about most of the states except for Massachusetts, it looks like. And so that's about the only one here. So great opportunities all around. And again, this is something that I think you can really focus on in your off season. And then that's just going to open up so many more doors during AEP when you're having those Medicare Advantage conversations again. I'm going to go ahead and talk about just a couple resources, and then we'll go back to some questions here in just a minute. We have CignaForBrokers.com. This is a self-paced, a self-service website that we have available at your fingertips. If you are a broker with us, you have access to this. But if you're also a broker with Medicare supplement benefits that are offered through Cigna Supplemental, you also have access to those sites where you can toggle into those from the same place. So it is truly a one-stop shop, CignaForBrokers.com. This is where you have access to Salesforce. That's where you can look at your book of business. You can look at your insights. We have some great retention tools. We've mentioned that retention word a few times. Great dashboards that help kind of manage that book of business to do some of those follow-up calls. But then we also have links to all of this is single sign-on, by the way, links to Cigna Producers University, which is going to house all the resources. It's going to house certification once that comes up in just a couple of months here. And then also some other things in here that really everything you would need access to as a broker with Medicare Advantage, you have access to this through Cigna for Brokers. And we would love to have a conversation with you, somebody on our broker manager team, in terms of walking you through what it is that you need to look at to be successful with your appointments. And it's David mentioned that great health risk assessment earlier. We do have a link in here that will open that up for you as well. So we have a lot of resources on Producers University. And again, we're going to get some copies to Sadie afterwards. So that way, if any of these are requested, we can get those distributed. But some of the best resources for your off season are going to be our retention job aid, otherwise known as Making Sales Stick. And there's even a grid in there that has a 30, 60, 90-day touch point graph that just explains all of the touch points that you would want to make to be successful with your retention. We also have a cross-selling job aid, which will go over more in detail some of those cross-selling opportunities. Also directs you how to get appointed for those products. And so really everything you need to know to get started would be in that cross-selling document. And then we also have a few job aids on low-income subsidy. And that is a great, it's an overlooked piece, not just for prospective clients, but then also clients that are on your book of business that may benefit from an LIS program, since a lot of the LIS stuff is going back to normal post-pandemic. You have these job aids here that not only talk about how to get become eligible as a prospective client, but then we also have an in-house vendor that works with your current clients to get them qualified for both LIS and even Medicaid to see what opportunities they have there. And then one last resource to point out, we have sell sheets that were developed for 2025 around the AEP time, but still very relevant. Has some of the key highlights in each of our markets in terms of product, in terms of some of the network partners that we have, and then has contact information in there for your broker manager that's going to be most closely tied to that market. And then we also have 10 reasons to sell Cigna Healthcare on the other side of those sell sheets. And we have, so that is not a low income subsidy. I meant to take that off of my previous slide, but that is going to be a great resource to get you, especially a great refresher, because I know even though we're just a few months removed from AEP, it's still kind of hard to keep track of what all is offered at each carrier. And we want to make sure that you have that all in one place. We also have a couple of other call outs with our support. In addition to broker managers that we've called out throughout this time, we have our strategist team. We also have Carl. Carl is the Cigna Agent Resource Line. This is a QR code that will pull up a contact card. If you want to add that to your phone, you're welcome to do that. This is our hours of operations for the remainder of the year up until October 1st when we get into that pre-AEP time. But Carl is there to help with a number of things, whether it's enrollment issues, if you're having issues getting into Cigna for Brokers, if you have questions about verifying eligibility, anything like that, they can help out with. They also have an email address that I often recommend, especially if you have something like a commissions issue, something that's a little bit more complex, has a lot of details to it, and you want to have a nice paper chain with that. You have the email available 24 hours a day. Highly recommend reaching out to them, and they are very helpful that way. We have a telephonic scope of appointment line that is available for any broker if you want to get a three-way call with your client and get that going. And then you also have a click to chat option that's available in our Salesforce portal that's in Cigna for Brokers. And then one other piece about just the support for the customer angle. One of our great things that I love about Cigna is that we have a new customer assistance line that I believe is available for the first year. But this is it's a number that is not the same number that's featured in all of the materials like the customer handbook. This is specifically for new customers that whenever they call, they're going to get a special advocate that is very aware of the ins and outs of starting a new plan with us and some of those frequently asked questions that they may receive. And so a little bit better experience in terms of getting that customer onboarded. And so love to highlight that. If you have not ever seen that before, feel free to take a screenshot of this and make sure to get your clients in touch with them. And then finally, as we wrap up here in this last moment, Proctor, if you want to take over with next steps and just walk us through a few things.
So now you guys are chomping at the bit, right? You guys are like, how do I sell Cigna? How do I sell Cigna? Right? So connecting with your broker manager team, virtual layer, local, we will get, Sadie, I think we can get the resource to you that's got a list of all the broker managers that attach to all the markets. That way you can disseminate those out. We've got new broker academies coming up. So any new brokers that aren't contracted, with this yet, that you guys, they're interested, get you guys off and running quickly. We got local broker engagement events that are going on in the markets each month, each week, each day. Business planning sessions, and then we've got off-season retail opportunities as well. So we've got all these different things going on right in everybody's backyard. We will get the contact for the virtual team, the local team, and everybody else in between, so that you guys can start this process to get acclimated and out there selling Cigna and making those clients happy. Q&A.
All right, we made it.
Yes, we sure did.
Long-winded.
David, I don't know if you have any on your side.
I do not have any in my chat.
Okay, I don't have any here. So guys, we'll give you just a minute more before we hop off here, because your time is valuable to us. But I just want to say I really, really enjoyed the what's the word I'm looking for? The diversity of different opportunities that you brought up today. It's like, take a look at the business that you already have. What can you do with that? We are very partial here at Senior Marketing Specialists to cancer insurance and making sure that you have that. If that's not something that you have now, maybe it's a good time to take a look at the Cigna product and see if it's something you want to add. But yeah, absolutely had a great time with you guys today. Everyone, they will give me those resources over. They'll get them over to me. You can also always reach out to your reps from Cigna that you know and love, but we can always get those resources out to you guys. But Chris, David, thank you so much. Is there anything else you want to add before we get out of here?
No, I think CP2 really did a great job in covering all those items for us. So we're gonna get this stuff over to you, and please don't hesitate to reach out if there's anything you guys need.
Yeah, absolutely.
Awesome. Well, thank you guys so much. We'll go ahead and get you out of here. Please feel free to reach out to our office if you need anything. But thank you guys so much.
Thank you.
Awesome. Thanks, Sadie.
Appreciate your time.
Appreciate it.